Hi, my name is Miranda, and I am an HR manager for RGA organization. We are a supply company that manages supplies for all hospitals and large doctor's offices in our area and across the United States. We supply any kind of medical item that you need to take care of patients. We have recently had a situation where one of our products was switched out through a vendor that was able to get us essentially a better supply and demand for the company, and so they were able to provide us with a bigger number. We went from receiving somewhere around 100 of these items at a time to triple that amount, where we can provide these quickly to our hospitals and our doctor's offices and get them taken care of. We were brought into a situation where we were told that these items are malfunctioning and that it is happening during some serious situations like traumas in the hospital or in the doctor's office when they're trying to see multiple patients. They're finding that these items are malfunctioning and it's causing a situation where it slows them down. So as soon as this was brought to our attention, we started working with our warehouse team to get those items flipped. And so that just means that that company that we've sold it to, we're going out, we're picking those up, we're bringing them back to the warehouse, and then we're getting new products shipped out to them as soon as possible. This does create a little bit of an issue with our supplier, because that means that they're having to provide us with triple the amount of the item that we were using so that we can keep up with the supply and demand. It's also causing our warehouse staff to have to work multiple hours of overtime, where they're used to working somewhere around 8 hours. They've been pushed to 12, sometimes 10-hour days to meet the demand of the market. Because of this, it has caused my team, the HR team, a lot more stress due to payroll situations as well as employee relations situations, and then support for our leadership team. What that looks like is when you have people working multiple hours of overtime, there may be bonuses in place that we're providing for them. There may be payroll issues where they didn't clock in and out properly, and so we're having to fix those things. It also looks like they're burnt out. They're struggling, they're overwhelmed, they're feeling like they're working too many hours, as well as my team, and so we're having to fill some of those things and give the leaders guidance as to how they can take care of their staff and make sure that they are taking their lunch break, they are getting a break during the day if they're going to be there for 12 hours, those kinds of things. Doing some rounding in those units to make sure that those warehouse team members are feeling supported and appreciated. The next thing that looks like for us is making sure the senior team has what they need, which is our administration team who manages the company. So providing them with the leadership they need and the support that they need from us. As a leader, my key components are always to lead with great communication, with teamwork, with fairness amongst my staff. So making sure that I'm able to give them transparency and let them know what this plan is and what it looks like as far as getting these products brought back into our system and exchanged for new ones, and then ultimately making sure that the hospitals can take care of the patient, because that's the most important thing, is making sure the patient gets what they need when they're sick and they need great care. The biggest thing for the senior team is helping them to manage things as they come through the media. Of course, anytime there's a bad product that's out there and it's affecting patient care, patients are going to take these things to the media, and so being able to fill the media and help it stop at the first level instead of continuing to spread and ruining our organization and causing more harm than has already been done. We appreciate you coming in and listening to us today and sharing a little bit about what our strategies are to prevent this from carrying on further into the community and to take care of our patients. And we hope you have a good evening.